the companies that make the foods that come here versus the same food that goes to Europe. And they have far fewer ingredients, far better ingredients. Why are we doing it to ourselves? Like, that's
it's a
what's
moneymaker.
This is where I get frustrated.
Don't even open that can of worms.
Like horrifying.
Horrifying. Not allowed to cry or have emotions in your house.
Like, do you really need to know what Zemoglyphosate is? Or
Oh, Jessica.
everyone has a favorite. Everyone does. Hey, Lauren.
Hi, Jess.
Oh my gosh, how are you feeling?
I'm good today.
Good.
You?
Okay, good. I'm good.
Yeah.
So today, we're gonna talk about something specific, but like this general, like trend, I guess, of like this Western v Eastern medicine and which one is better and whatever. Specifically, your GLP-1s, which is your Mounjaro, Wegovy, Ozempic, which is like all over everything. It's on your Instagram feed.
Yeah.
It was like, there were like two ads or commercials or whatever on Hulu or whatever I was watching. And like, I don't even think, I think it wasn't Ozempic, but it was like Mounjaro and Wegovy. Like it was two, and I don't know if they're like compete, like whatever. Anyway, so today we're going to dive deep into your GLP-1s.
Yep.
And we have a fab guest who's a little expert today.
Yes.
So, Megan.
Hello, ladies.
Hi.
Thanks
So
for
introduce
having
yourself,
me.
of course. Introduce yourself. What do you do?
All right.
What's your background?
All that.
So, my name's Megan Landry. I am from New Orleans. So, I am a Western medicine physician, but also moving a little bit over. So, I did med school here in New Orleans at LSU. I did emergency medicine residency training here through university at the time. Katrina flooded, the charity system when I was in med school. And then I have practiced emergency medicine since I finished my residency in 2012. Currently I am still in the emergency department, like 4 shifts a month.
Oh.
But towards, I guess, definitely around the COVID pandemic, but a little bit before that, was definitely getting frustrated and kind of burnt out. The emergency medicine rate of burnout is super high.
Yeah.
So getting burnt out just with all of it's a constant busy every
Crisis.
day. It's a lot of go, go, go. It's a lot of turning and burning, like seeing the patients moving the meat, and started to get worn out, but wasn't quite sure what I was going to do, because what do you do with a medical degree after you have, done this? Like it's very hard. You've been like tunneled for a long time. So I wasn't quite sure what I wanted to do. And then in the middle of all that, got diagnosed with breast cancer. Yeah. And as much as, it's not like it's anything you wish for, but at the same time, it kind of came at a point where I needed that push to do something about it. Mm-hmm. So it was early enough that it got diagnosed and treated, and I didn't need chemo, didn't need radiation. I just do medications for, hormonal natural stuff, that stuff that I need to, affect in my body so it doesn't fuel that to come back.
Right.
But that was the kind of push to say, okay, you've wanted to do this for a long time. Like, now you got to do something about it. So that was where I dove into, if my, DNA testing for cancers is all clear and I eat right, I exercise 6 days a week, what am I doing wrong? Mm-hmm. And definitely fell into a lot of looking into nutrition medicine, and then the sleep deprivation and the constant stress and the cortisol overdrive was definitely fueling all this stuff for me. So that pushed me into the direction of doing a lot more of the nutrition and, holistic stuff, Eastern medicine kind of stuff, which we can always combine, but there's definitely things that you can do, naturally, and in a preventive way to not get to that point. So that's kind of how I ended up there.
So you kind of started by like treating yourself, basically.
Like looking into it, and then that eye-opening, why did they never teach any of this in med school? Like, how did I go to school for this long and go through residency for this long? Now, granted, emergency medicine, that's not the kind of stuff you're usually focusing on. But still, to get this kind of shock of, nobody taught me this in school. And it's super frustrating.
Thematic, I feel.
Yeah.
Like, that's been like a thematic, and whether it's like... I just feel like MDs, like psychiatry, also like nutrition and I don't know, but whatever. Nutrition and like things like that is like a gap
Yeah.
in
it's
any
huge.
sort of physician's studies.
Yep.
Yes.
Like it's just not talked about, which is interesting.
Yep.
And it's across all y'all.
Yep.
Yes.
And I think it takes, for a lot of us, it takes like going through something personally
Yeah.
to open your eyes and be like, wait, I'm missing this whole part of my own treatment and recovery. And then once you dive into that, you're like, okay, now I can't unsee all of this.
Exactly.
You know?
No,
Like,
I know. Ever since I was diagnosed, it turned into it doesn't matter to you until it matters to you.
Yep.
Yeah.
And then once it does, you see all this stuff, you pay attention to things more, and it's just a whole different perspective that you can't
Ignore.
unsee that.
Right.
Yeah.
And then
So-
it makes it hard to continue practicing
The same way.
in the Western medicine
Yeah.
world,
Yeah.
you know?
Okay, so tell us what you do now.
So now I am working, doing more preventive care, wellness at New Well Medicine. I know you've had one of my coworkers on before,
Yep.
so Lauren Hernandez.
Yep.
So I am working there, and then still doing 4 shifts a month in the ER.
Okay.
It gives me
A little cake. You need a
insurance.
little. Oh,
Gives me
just kidding.
insurance,
I was like-
actually.
I was
You
like,
gotta
I
get those
just need some
benefits.
drama. Like,
It
you need
gives
a
me
little
good medical
drama.
insurance. Well, I mean, at the facility where I'm working, there's not a ton of drama. It's a low patient load, so it's not.
Oh,
Yeah.
okay. Well,
yeah.
Okay.
But it gives me good insurance.
Yeah,
That's great.
great. Well, that's fab. Okay, so let's do some trend stats facts on our GLP-1s.
Yep. Do you want to start with
I'll
obesity
start, you
rates?
do, yeah.
Okay.
Okay, so obesity rates here in the U.S. are actually declining, and the downstream effects of obesity-related conditions like heart disease, stroke, joint degeneration, GLP-1s are actually a contributing factor, they say. And so first of all, how does a GLP work?
Yeah.
Let's talk about that real quick.
So, okay. So, and then before you were talking about, Ozempic, Wegovy, I don't know, what's the difference? What
Yeah.
are they? So you've got your earlier GLP-1s, which semaglutide is, kind of the, they have the generic names, the trade names. So you got semaglutide, which is Ozempic, which
Okay.
is the indication for diabetes type 2. And then you've got Wegovy, which you're looking at for obesity or weight loss.
Oh, they're different.
So
I didn't know
those
that.
are just different formulations, but those are the GLP-1s. So then if you hear, the talk about tirzepatide. So what's semaglutide, tirzepatide? Tirzepatide is going to be not only a GLP-1, but also a GIP. So looking at another receptor.
Okay.
So the tirzepatide is going to be the Mounjaro
Oh.
for diabetes.
Okay.
And then you're going to have the Zepbound, which is for obesity
Okay.
and weight loss.
Okay.
So just different classes. So then super interesting is they're actually in studies of looking at retatrutide, which is a newer one. So the retatrutide is going to be the GLP-1
Okay.
and the GIP receptor, and then looking at the glucagon receptors too. So another
Oh,
kind
Lord.
of target.
Okay.
So another. So which
Is one strong? Like, is Ozempic like the strongest? Like, is
well,
that?
so it's just like generic and trade, but basically they're all kind of doing the same
I'm
effect.
sorry, y'all.
LOL.
LOL.
They're all
Work
kind of
never stops.
they're all kind of doing the same effect,
Okay.
which is basically the purpose of them is looking at, so when you eat,
Yeah.
glucose is coming into your system,
Yeah.
into your circulation, into the GI tract. Your GI tract is going to naturally release GLP-1.
Okay. Why?
So you're releasing GLP-1 so that you're stimulating your pancreas to release insulin, so that your insulin is triggering these cells to uptake the glucose.
Okay.
You're suppressing glucagon. So glucagon is going to be another part when your glucose is low that your body's going to produce to whether it's releasing glycogen stores from your liver or your muscles to put out glucose.
Okay.
So you're basically overall trying to decrease the amount of glucose that's there. The other thing it's doing is slowing your carbohydrate absorption.
Yeah.
Okay.
So increasing your satiety. But when it slows down the gut, that's where some people can get the kind of slowing of the gut, nausea, stomach upset.
Yep.
Okay.
So that's kind of part of it. And then it's also going to be, which you might be able to speak to this more, stimulating some receptors in the brain that are controlling appetite and regulating your satiety.
Right. Right.
What's the satiation?
Satiety, feeling full.
Feeling full.
Yeah.
Okay.
So
I know
basically
satiation.
making you be aware of your fullness.
Yeah.
So where
it's
we're
just-
eating things that maybe are carbohydrates or processed, and those kinds of things are made to
make you eat more.
make you eat more.
Because it hits those
Right.
reward receptors.
Yes.
Okay.
Yes. So these medicines are triggering some satiety in your brain so that you're not constantly
Just
Hungry.
eating
yeah.
a box
so
of
you're
cereal.
feeling full and saying, I don't need to eat more.
Yeah. I mean,
Or maybe don't want to eat more.
Right.
Because
Yeah.
you feel full.
Right.
yeah.
Right.
Okay. All right. So some mental health like stats too. Lauren, you're going to do that.
Yeah. So because I have so many patients on these injections, so many, and I think a lot of people don't realize that there are a lot of psychiatric or mental health side effects, adverse effects from GLP-1s that I see come into my office. So GLP-1s lead to a 98% increased risk of any psychiatric disorder. 98%.
98%.
Okay.
That's huge.
A 2.4-fold increase in suicidal ideation and suicide attempts in patients on Ozempic.
That's crazy.
216% increased risk of major depression. That's not feeling sad. Major depression is like a clinical depression. 108% increased risk of anxiety. And interestingly, Black patients are at the highest risk compared to other racial groups for increased anxiety. Okay. So they have like 137% increased risk. I don't know why, but that's what the statistics say.
Okay.
So, so we have all of that data in adults. What concerns me is, like with most medications, we get these studies on adults, right? And then they just extrapolate that to kids, but kids are not small adults.
No.
So we don't have all of the research to say, what does this look like in kids long term, but we just assume, oh, if this is how it looks like in adults, then that's what it's going to be in kids. So, we're seeing this huge increase in the number of GLP-1 prescriptions in kids.
And this is, so it's now approved for kids 12 years and
12 years and
older.
up. Yep.
But can a provider prescribe it to someone under 12 years or absolutely not? Like, is this like a recommendation or is it like you
No,
cannot?
I think they can now.
I think you can. I mean, there's a lot of things you can do off label
Yes.
or
Yeah. Okay.
that aren't necessarily indicated for a certain age. Now, I mean, that's definitely a shared decision-making conversation.
Right.
Yeah.
But then the conversation comes up, which, I mean, you're obviously seeing the mental health side of it, which is super interesting to look into that, which I'm curious about the pathways. But also, I mean, when you talk about, not knowing what these issues are with kids, I mean, so the amount of patients that, and there are definitely people who don't, but that rebound with that weight gain after they come off of it.
Yeah.
The number of people, I mean, you've seen the videos or seen the people. I mean, I know I've seen it, Ozempic face.
Yeah.
Where
and hair. The hair loss, right?
Yeah.
that they don't take in enough protein while they're losing
Scott Disick.
this weight. And then you get this kind of sunken in appearance.
Yeah.
Yeah.
So the next thought is, okay, so if you do this for a kid, what is that doing to their development?
Right.
Mhm.
What is that doing to their overall health, like their bone mineralization?
Yeah.
All that kind of stuff that if this kid has, satiety or doesn't have a whole lot of appetite, is that kid immediately going to say, oh, I need to make sure I prioritize my proteins. Let me make sure I'm taking in the chicken or the eggs or, whatever to get high protein in so that they're actually taking in what they need.
Well, that's the parent's job to do that.
Right. But
Yeah.
that's what I'm saying. Now, when they go to school and there's,
Yeah.
lunch or snack time or they're at a party, like that's the kind of stuff that it takes a lot for a kid to be aware of that on their own and make those decisions.
And I feel, I don't know if I found this or not, but I'm going to say it anyways, whatever. I feel like not depending on the weight, like the actual weight of the kid. I feel like if you slap one of these on a kid, especially in those like formative, like I'm already really insecure.
Yeah.
I really care about what my peers think. I'm really impulsive and whatever. I feel like it would increase the risk of producing an eating disorder.
Yeah. I mean, that's definitely a possibility. The scary thing to me is like, we're not going to know the outcomes of this in kids for decades.
Long time.
Right?
Right.
And like, it's not like the prescription rate is slowing down. It's speeding
Yeah.
up for kids.
What is it? Do we know?
So,
don't
okay,
know.
so just some numbers because it's a little staggering. Okay, so from 2020 to 2023, the number of GLP-1 prescriptions in adolescents and young adults increased from 8,722 to 60,567. So that was almost a 600% increase, okay? Whereas interestingly, they didn't give me a lot of detail on this, but I'm going to say it. Whereas dispensing of other drugs, they don't classify what other drugs, decreased in this age group by 3%.
Dispensing of drugs other than, what does that mean?
The rate of GLP-1 prescriptions
Increased.
significantly increased, but the rate of prescribing, it says
Anything else?
any other drugs
What does that
decreased by
mean?
3%. So, I mean, that's like
so
a huge...
we're not increasing on stimulants necessarily or other things. I don't know.
Yeah.
Yeah, I don't know. They
just
didn't
that one, I don't know. That's
specify.
But
what
also,
vague.
like, this is so terrible. Just give them some fucking Adderall. That'll change their appetite. I'm kidding. I'm kidding. I'm joking.
But
also,
but
like,
ching.
I mean, I could change, like, don't. But also, okay, here's my devil's advocate thing. Okay, so, and like, I said this before. This isn't like, I don't need an answer.
Yeah,
I'm just like
yeah,
literally food for thoughting.
Right.
So, okay, we don't know what like long-term effects of we don't really even know for adults, like long-term
No, you
effects
don't
of
have
these, right?
No.
a long
Nope.
Right. We
list of
know
data.
we have information about what psychiatric medications like what the like long-term effects of those can be in kids. Like we have that information, we still do it. Because I mean, not to throw like schools under the bus, but because a kid's behavior in a school, like I'm just using a fake case, even though it's not fake. A kid's referred to us, you, me, whatever, because their behavior is so egregious in school. It's disrupting the classroom. It's disrupting the teacher. It's disrupting his classmates, or his ability, her ability to like absorb, retain, and like reproduce academic information. Okay. And so like that is the priority over like not medicating or using other interventions. So
Right.
it's give them the stimulant and like it normally like the result is the impulses go down.
Right. They sit still.
You get the
They
result
sit
you
still.
want.
Yeah,
Yeah.
correct. You get the result you want, and the kid hopefully is whatever.
What's happening in the meantime?
Yeah.
Right.
And so, and you know, because we've talked about this, that maybe not stimulants, but like mood stabilizers, and those aren't. Doctors don't just like hand those out like candy.
Depends.
Oh.
You can always find your
I would
people.
say good doctors don't. Good
Yeah.
doctors don't.
Okay.
Who actually do their job.
Yeah. So
They
gosh,
do
there
the same
was-
things with antibiotics.
Yeah.
Yeah. Okay.
Yeah.
So real quick, do you know like are there any long-term effects of stimulants on kids?
That's such a good question.
And
We could do a whole freaking episode on that.
Okay. Can you say it?
Okay, so
like
here
in a short for Mac.
we don't know because people don't want to do studies on kids. That's the problem.
Oh.
People don't want to do research on kids because no one wants to sign their kid up to be an experimental subject, right?
But we
in a study.
But we have data on like mood stabilizers in kids.
We
Or medically speaking or whatever, y'all know.
We have some data. We don't have a ton of like when you say long term.
Yeah.
We don't have a ton of long term, as in like decades later. What do these kids look like? We have some long term studies, quote unquote, that are for like a year and a half or 2 years, right?
Yeah. But like, okay, we have your GLP-1s, Adderall, or stimulant, whatever. Both suppress appetite, right?
Yeah.
So then both could be a barrier in development and nutrition in the brain and the whatever.
I'm sorry, y'all.
my
This
God,
is so
Lauren's fucking up
aggravating.
today.
I don't know how to
You're popular.
stop this.
No,
I'm sorry.
are
Continue.
Are these all clients?
Yes, this is all work. It's
Why is
so
it on your
aggravating.
computer?
I don't
Just
know.
mute your computer.
Okay.
Anyways.
Y'all, I'm so technologically challenged. I really
It's like hit
apologize.
oh my God, Lauren. There we go.
Oh, okay, thanks.
I'm upset. Jesus Christ. Anyways.
Sorry.
So, okay. So they both do the same thing. And like we aren't as we're not as concerned about Adderall. Or
we should be.
We should be, but
I think parents aren't. They would
Parents
more easily
aren't.
put their
Yeah.
kid on Adderall
Yes.
than they would a
Yeah.
GLP-1.
Yes.
But also to what extent? I mean, I know it's suppressing appetite.
Yeah, I don't know.
But you're also not getting, I don't know if it's just a gradient of how strong it's doing, because you're not getting that nausea, vomiting, stomach upset.
Well, and the
or the
other thing is that you have to
gastroparesis
think Adderall is only in your system for a period of time, right?
Right.
Versus a GLP-1, when you get an injection,
supposed to
that
be-
is there all the time. For how long? How does it long?
continuously
Months,
doing
weeks,
it.
You know,
But you have to
versus-
inject it every day, right? Oh, once a week.
No.
You don't have to inject it.
No,
every day.
no.
Is it
You,
once a
you
week?
get like an
Some
injection.
people, yeah.
I think it depends on the
Some
drug,
it depends on the medicine, but
Oh.
no, it's not a daily
No.
injection.
It's like every 2
I took
weeks
one
or
shot,
every
y'all.
week or whatever. I don't
Yeah.
know. But like Adderall is going to be in your system for, at best, a long-acting Adderall is going to
Yeah.
be in your system for 8 hours maybe,
Okay,
you know?
fine.
And then when it's not in your system, it's not suppressing your appetite, you know?
Okay, so let's say we have a kid who, and I think, God, whatever. We have a kid who's 6, 7, 8, diagnosed with MDD. I don't
Okay.
know.
Major depression. Yep.
Yeah, major depressive disorder. Okay.
Okay.
And some wacko puts him on like a heavy duty psychiatric
Correct. Yeah.
drug, like a mood stabilizer.
Right.
What's an example of that? Like a
Like I'll get kids come to me on like an antipsychotic.
yeah, that's what I
Like
meant.
a
Yeah,
10-year-old on an antipsychotic.
yeah.
Yeah.
And what would that do to them?
But some of don't some of those atypical antipsychotics increase their weight?
Yeah.
And
Yeah,
But what does it do to
Like-
other organs? Doesn't it like
Right?
influence? What does it do?
Yeah. I mean, it does all kinds of stuff. It increases their risk for diabetes,
That's
metabolic
right.
syndrome,
That's
you know,
right.
hypertension, obesity. Yeah.
Yeah.
Yep.
Yeah. And not us. Well, not me. I don't prescribe anything. I'm not a doctor. But like,
But you're with
I
us. Yeah.
prescribe. And doctors out there will prescribe that.
Oh, yeah.
And so like, it's, I don't know.
So I think what it all boils down to is like this American way of medicine
Mm-hmm.
where instead of being preventative. and focusing on the things that make a difference for all humans. Nutrition makes a difference
Yes.
for all humans. Exercise makes a difference for all humans. Sleep hygiene, okay? Like all of these things, time outside. Instead of focusing on those things, we're so
Yes.
focused on the Band-Aid after the fact.
I
We're so
agree.
focused on like, okay, how do we clean up the mess, you know? And like GLP-1s are an example of that.
Yeah.
Stimulants, antipsychotic. I mean, granted, if you have a patient with schizophrenia, they need to be
And
on
they
an
need
to
antipsychotic.
take a psychotic,
right.
But a lot of times I think we're just like Band-Aiding because doctors, to be honest, don't know any different. They don't.
No, it's so I kind of alluded to it earlier when we were talking. This encompasses the entire idea of why I tried, I've shifted away from the Western medicine, because when you look at, y'all were talking about stats earlier, when you look at another stat, when you're looking at particularly adolescent or childhood obesity,
Yeah.
we were 5% maybe in the 70s. We're at 20% now.
Why do you
Based on
think?
2020. So
Oh, I
it's,
know, but go ahead.
the food, the ultra processed foods, the lack of activity,
Yeah.
the stressors, whether they feel it or not, there's constantly
yeah.
doing and
Yeah.
practice, whatever. But they're far more inactive than they were.
Yeah.
The food system's terrible.
Was it
So-
not shit back then too? Like, were there?
No, so it was starting in the 80s is where you had the ultra processed foods because it was, which I mean, have you listened to Casey and Callie Means?
Yeah.
book?
I don't know
So yeah, when they're talking about, how they were shifting where the tobacco industry kind of started to become a problem, where they're looking into cancer causing stuff and tobacco industry shifts, and some of these big names bought these big food industries.
Like Johnson
And
and
then they
Johnson.
shifted from the addictive tobacco to let's
Sugar.
make food that people
That's
want to
addictive.
keep
Yeah.
eating that is addictive.
Okay.
So then you've got these kids that are eating all these foods, and that's the thing. So the amount of money and time that is poured into let's research how we can get these medicines to get people to lose weight. Let's research all this stuff. Why aren't we researching doing the foods correctly?
Right.
I mean,
well,
all the companies that make the foods that come here versus the same food that goes to
Europe.
Europe and wherever. And they have far fewer ingredients.
Yep.
Far better ingredients. Why are we doing it to ourselves? Like,
Yes,
that's
it's a
what's
moneymaker.
frustrating.
Because it makes money.
That's what's
America
frustrating.
is all about the dollar.
Yep.
No, I agree. And that's what gets frustrating. So let's create this whole system where our kids are now getting obese and then they're set up for, adult obesity and the cardiovascular disease and the, weight-related cancers and all those things that go along with it instead of dealing with the problem. That's what's, the hard part about it.
But are there circumstances where a 13-year-old who is clinically obese would benefit from a GLP?
I mean, there are definitely some adult situations where, yes, people can do it and they can kind of get a jump start. There's certain people who actually do well with it and have done it, gotten a jump start on the weight loss, and they actually keep the weight off after they get off.
Because
there's a huge number of people that don't.
Yeah.
So then the question comes, if you're going to start this kid on that medicine, are they going to rebound and gain the weight back? And then that's going to be something that they need for the rest of their life, which, I don't treat kids necessarily.
But I think it's all that prevention stuff, right? It's okay. And this is the part, and this is also the issue. It's if you're going to do that kind of extreme measure to combat this obesity in kid A, then the parents have to be prepared to have ongoing conversations about self-image, about weight gain, about relationship with food. Pairing whatever the GLP-1 with nutrition, movement,
right? What are we doing
Exactly.
about it to
So
change those patterns? Because
Right.
It's
the
a
medicine is
lifestyle
not going to
change.
fix everything.
Yes, it's
Right.
a Band-Aid. It's Band-Aid.
It is.
It's a great jump start, and you the goal is not to be on it forever, just like any medication. I mean, really. And so it sounds like if the parents or guardians, whoever the kid is with, and I mean all of them, that means teachers, school, everyone on the same page about that, are super preventative and then implementing systems and interventions with the GLP-1, then it could be beneficial.
Yes.
But that is no.
No, I think it could. That's the hard part when you talk about there's potential that it can. I just worry about long-term stuff. But when you talk about you need the school on board, whatever, I had one of my kids come home from school and tell me, they're selling snacks at lunch and it's Cheetos.
Yeah.
And I said, they're selling Cheetos at school? And one of my kids said, they're baked. And I'm like, stop it.
The baked Lays.
Stop the conversation. And then I emailed the school about it, and it was, based on the USDA recommendations, it meets the goal for
Why are they selling
a
snacks,
healthy
though?
snack.
Aren't
Exactly.
we paying
We're
for
at
snacks?
lunch.
They
Yeah.
should be free.
But we're also they're eating lunch.
Yeah. Why?
And then
And then they're gonna
and then
sell
they
them
have to bring a
trash to
snack,
eat
which I don't
instead of lunch.
understand.
Yeah.
But yes, so it falls within that, just like the 100-calorie packs.
I just
Yeah.
I just
Oh,
right, no, but okay, but these aren't bad, or they're not as. And y'all, this is the issue. I forgot the doc. Anyways, I was at Fresh Market getting a bag salad for lunch today. Whatever. And
Don't judge.
Okay, I'm a
least
very
it's a
clean
salad.
eater, normal. Okay, and I'm sitting there, and they're slow, and I'm looking at the checkout stuff, what's up there? And then I see Blue Diamond almonds. Or whatever, and it's the 100 cal or 120 cal, whatever pack. And it's the dark chocolate. I'm mixing the dark chocolate, naked ones, and then wasabi and something. So, but I got that.
Okay. Well, that's
That's
great.
not terrible.
It could
No,
be worse. It's not Cheetos.
No, it's not Cheetos, and
Yeah.
it's not that kind of ultra-processed food
Yeah.
that's, super addictive. Now, you can get into a debate about dark chocolate and how much sugar it is, whatever. That's a better option, but you can't have nuts in schools
Right.
for the most
Oh,
part.
shit. You
I
can have
know.
almond nut.
No, you can't have
They're
any nuts.
nut-free
Yeah.
for the
No
most part.
nuts.
There are some who will allow it, but for the most part, they're not free.
free.
So
Why are
some
they
of that,
selling snacks?
I don't know.
I know.
It's we pay so
But-
much fucking money.
But that's what I'm saying. When
Yeah.
you're trying to say you got to have the school
Yeah,
on
yeah,
board,
yeah.
well, when
Yeah.
that's what they're selling,
Right.
Yeah.
you know.
No, I know. That's what
it's
I'm
a
saying.
system problem.
That's a perfect.
That
That's
would be the
perfect. That's
ideal
That's
situation.
the outlier.
Right.
Yeah.
That doesn't happen. That doesn't
No,
happen
no.
with
No.
our clients who are taking or not even on meds.
Right.
You know what I mean?
I mean,
Like-
I have so many clients who go to like a med spa and get a GLP-1 and like
Yeah.
no one is tracking them, following up with them.
How
like
is that
there's
even, like,
just,
legal?
So
it's,
anybody can prescribe anything. I
What?
mean, there are,
Yeah.
well, I mean, physicians can prescribe.
yeah.
You
People
know,
ask me for GLP-1
Yeah.
prescriptions.
Yeah,
I'm like,
but,
hell
like,
no. Hell
Who's at
no.
the med spa? It's like a nurse practitioner.
I don't even know.
so, I mean, I don't know. I mean, so there are certain patients that, yes, have done all the things. Because,
Yeah.
I mean, we're looking at their gut. We're looking at their
Yeah.
hormones. We're looking at, you know, the DNA. We're looking at all the things. And if they've gotten to a point where we've done all these things,
Yeah.
then, yes, there are some people that we will try doing that.
Mhm.
But
It's not your first.
But it's also something that we are following up
Yeah.
when we do it at 4 and 6 weeks.
Yeah.
We're following up with electrolytes and we're following up with labs for their pancreas because we
Yeah.
want to make sure, are you having symptoms? Do we see lab issues? Because if
Yeah.
you are, we're stopping this. We're
Yeah.
not doing this.
Yeah.
You know, we don't want to be doing it in people who, you know, have a history of gastroparesis or slow gut motility because then that's just going to make it worse.
Right.
If you have a history of pancreatitis, I don't want to be doing that because this is something that can easily cause pancreatitis.
Mhm.
So those kinds of things, yes, you're not doing that. But yeah, I mean, if we're doing it, we're definitely following people up for
Yeah.
symptoms and looking at labs. And that's, you know, that's kind of why when we do it, we're doing it as like a membership. Like you are a patient that is following with us because
Yeah.
I don't want to treat and street because then if there are issues, we got to
Treat
know
and
about them.
street.
And we got to
That's
be able to
good.
say,
Yeah.
let's stop doing this because
Yeah.
otherwise you're going to end up down the road with some,
Yeah.
you know, catastrophic GI
Yeah.
issue.
Yeah.
Yep.
We don't want to have,
Right.
you know, become a problem.
Okay, so takeaways. All right, so we know, or the data says there's an increased risk, 98% of a psychiatric disorder.
Yep.
Okay, increased risk of MDD, major depressive disorder, increased risk of anxiety, increased risk of suicidal ideation and suicide attempts. Yep. Okay, we don't know how it's affecting kids' development.
Long-term.
What
Yep.
we do know is that if they're taking a medication that's a barrier to eating, then they may not be getting the nutrition that they need or
Yep.
the types of foods that they need to develop appropriately.
Correct.
We just said and know that GLP-1s can work if it's a perfect storm. Everyone's on the same page.
Yeah.
Everyone is like following, tracking. You have this beautiful New Well medicine you're a member.
Right.
Like, and the parents are like tracking nutrition, like having self-image discussions, all that stuff, movement. And that's not the typical
That's not the norm, unfortunately.
No. So
Nope.
that's the outlier. And other takeaways.
I mean,
Go.
huge, I think, is putting in some of the work first
Yeah.
and not
Yeah.
going to that.
Yeah.
You know,
Preventing
making
obesity.
sure,
Yes.
yes, making sure that we're not going to go see the doctor about talking about a potential GLP-1 in my 13-year-old child.
Right.
At the same time, later that night, we're going to go pick up
Eat
the
ice cream.
fast food and
Yeah.
Yes.
go get ice cream. So there needs to be some work done on the front end to say,
like a screener almost.
well, and also, I mean, whether child, adult, whatever,
Mhm.
on a GLP-1, it is supposed to be involving the appropriate diet and the exercise
Yeah.
and focusing on the,
Yep.
you know, the protein intake
Yeah.
and things like
Yeah.
that. So, I don't like the knee-jerk reaction to
Yeah.
the
Yeah.
medicine. I think we need to be making sure that we're working on the other things that are going to have to be a lifestyle
Yeah.
incorporation
Yes.
in the long run anyway.
And this
Right.
is like any this is like any, especially in our field too.
Yeah.
Like, if your kid has a behavioral issue
Mhm.
and you slap a med on it, and then you're still like have inconsistent expectations.
Yep.
There aren't any consequences. You're yelling at your kid, like all of that stuff. The medication's not
not
fixing
going to
that.
fix all
Nope.
that.
It's not going to
Yeah.
fix
You
it.
need the pills and the skills. That's what a teacher
Oh
told
my
me one
God,
time.
Yeah.
stop.
I like it.
Wait, what did
like,
you
it's
say?
so true.
Medicate? No, you said
Oh,
treat,
treat
and
and
street. Treat and street. I'm
Don't do
obsessed
treat
with
and
that.
street. Do
Don't-
pills
Yes.
and skills.
Yes.
Like
That
it.
should be the-
That's your takeaway.
That's your
that's our
takeaway,
slogan.
and that's going to be the title of this episode.
Yes.
One of those or both of those. All right. This was great.
Yes. Thank
thank
you,
you so much for
Megan.
coming on.
Thanks for having me.
This was great.
Yeah. I
Okay,
mean, it
we'll
was
probably have you back.
Yeah.
not the anxiety I thought it would be.
Okay,
It was
good.
very
I know.
easy.
Easy.
It was very
Yeah,
easy.
it is
Yeah.
easy.
We don't bite.
I mean,
A little
hard.
Jessica bites a little.
all right. If you want to learn more about New Well Medicine, are you on Instagram, website?
We do have social media.
Okay.
Our website is newwellmedicine.com.
NUWELL.
NUWELL medicine.com. We have locations in Florida, New Orleans, Lafayette. We see people virtually. So there's even providers here who are going to see people who are
Cool.
out of state or
Making it easier for people to get
Yes.
access to
Yep.
Yes.
quality medicine.
Yes.
Yep.
That's right.
Absolutely.
Okay.
All right,
y'all.
thanks.
Bye. Thank you for tuning into this episode of the Little Brain Campaign podcast.
If you enjoyed our conversation, give us a follow on your favorite podcast platform so you never miss an episode.
And hey, those ratings and reviews, they actually matter, like a lot. Take 30 seconds to leave us a review while you're still thinking about it.
Until next time, remember, we're all just trying our best.
See you next week.